All right. So, good evening, everyone, and thank you for joining us. We're very pleased to have Jean LaMantia here. She is a registered dietitian, a cancer survivor, and the author of 4 books on the topics of lymphedema, cancer, and intermittent fasting. She's also the creator of daily and weekly journals to help individuals with lymphedema and lipedema track and learn about the impact of diet and self-care on their health. She's the creator and facilitator of Lymphedema Nutrition School, an online program to help people living with lymphedema, as well as a professional CE course for dietitians and lymphedema therapists to help educate and advocate for nutrition management of lymphedema. She has spoken at national and international conferences and is a strong advocate for a multidisciplinary approach to lymphedema management. And she is the recipient of the Distinguished Practice Award from the Oncology Dietitians Dietetic Practice Group of the Academy of Nutrition and Dietetics. She lives in Toronto, where she has a virtual private practice, and you can find out more about her and read her blog and books at her website, which we'll put in the chat. So, needless to say, we're very privileged to have her here speaking with us this evening. And with that, I'll pass it over to you, Jean.
All right, thank you. It's nice to be here, and it's good to see everybody. I have my little screen open. I think most of you are familiar with Zoom, but if you're not, because I'm going to show PowerPoint slides, in the upper right-hand corner, there's a view button. And if you want to give yourself the option of seeing the slides big, I would suggest that. I think it's called presenter view. You don't want grid view, okay? So yeah, active speaker view, I think it's called. Anyway, so let's get started. I'm hoping there's going to be a nice discussion because I'm sure you've got some great questions. And I'm just curious too, maybe you can type in the chat if you have lymphedema yourself, or if you're a lymphedema therapist, or both, because some lymphedema therapists also have lymphedema, just so I know who I'm talking to. But let me share with you a little bit about me. I think this all came through. I am a cancer survivor, so I had lymphoma, which is lymph node cancer. So the lymph nodes in my neck, under both arms, and in the middle of my chest were affected. I had a 15-centimeter mass, like a grapefruit, basically in the middle of my chest. And so I do have an appreciation for the lymphatic system. I like to create things, and you'll see I have some samples of things that I have created. And a big part of the way I work as a dietitian is what's called evidence-based practice. And so just to share a little bit more about my philosophy, I call this 5 things I've learned about being a dietitian. Number 1, no matter how many times I hear something, I do my own research. And right now, social media is a really good example of that. You might get on Facebook or Instagram or something, and you see those people, I call them the supermarket screamers, right? Who get in the supermarket and they pick something off the shelf and they read it and they tell you why this is trash and you should not eat it, right? And so right now, it's very trendy to say seed oils are trash and don't have anything with seed oils, and seed oils are inflammatory. Well, I'll show you some evidence later that totally contradicts that. So this is a big one for me. No matter how many times I hear it, I like to dig into the research. Now, I actually enjoy reading the research, which I know is not everybody's thing. So your solution to that might be to go to your trusted sources. If there's something, and people usually will come to me and say, well, I heard this. What do you think? Well, already that's telling me this thing that they've heard is not sitting right with them because they're questioning it, right? So just be aware of that. If you're questioning something, look into it a little bit more. I don't become emotionally invested in ideas because the science evolves and I need to change with the science. So if I'm really invested in thinking a certain way, then I'm not going to be open to the new evidence that comes out. And this has happened throughout my career. I've been a dietitian for 30 years. And there's things that, I learned in the beginning, but the science changes and you have to evolve. Number three, I need to find the right diet for the patient. I don't make the patient fit the diet. You, I do see this in some corners of the lymphedema community saying that, oh, for example, this diet, everyone's got to do this diet. If you've got lymphedema, this is the diet, right? Number four, the best plan is the one that my patient or student can follow, right? You might think this is the ideal eating plan. If I've had cancer, I need to eat this way. Well, it's all good on paper, but if you can't do it, then, right? It's like having the best pair of compression garments that you're not wearing. I collaborate with other health professions and make referrals. I don't know everything. I try to practice within my scope, and I am often referring to certified lymphedema therapists. So this is a freebie download. So if you want kind of a handout for today, go to my website, and I have two. This one on the left, 7-point eating plan, I have in mind for the people who have lymphedema. So if you have lymphedema, you can download that one. This one I have in mind more for the professionals. So if you want to, this is a template. You open it up in Canva, you put in your clinic logo, your clinic info, and then you can save it as a PDF and print it off for your clients. Okay? So those are available at jeanlamantia.com. All right, let's get into it. We're going to talk about the top 7 nutrition tips to improve your lymphedema management, because that's what we want, right? We want to feel better today with our lymphedema. We want to reduce the swelling, the heaviness, the aches, the itching, whatever current symptoms you have. Also, we want to delay the progression, because sadly, at the moment, lymphedema is still a chronic condition. That means there's no cure, right? And it's also, on top of that, progressive. And sometimes if you don't look after it well, it can progress in a way that really makes things a lot harder for you. So we don't want that. All right, so let's get into it. So let's talk first about salt and water. And this might be obvious, but salt is not your friend if you have lymphedema. And the main things you can do here, be aware of how much salt is in your recipe, is in your food. Read your labels. That's a really good thing. So if you take, some action items from today's talk, you can start looking at the labels. Now, what do these numbers mean? I have to put it in perspective for you. So a good target for you is 1,500 milligrams of sodium per day. Okay, that's the current Canadian guidelines. Sometimes like people are at 2,000, and that's still pretty good. The average Canadian intake is 3,500 milligrams of sodium a day. What you'll notice is the foods that have the most sodium are restaurant foods and processed foods. So if you tend to cook most things from scratch, you're probably good. Okay. Now, I want to show you why this is an issue. So we all have cells in our body, and think of these circles with the dotted lines. These are your cells. But cells have a semi-permeable membrane, and that's why it's not a solid line, it's a dotted line. Inside the cells, we have ions. So ions are compounds that have either a positive or a negative charge. So I'm taking you back to grade 9, grade 10 chemistry, okay? If you remember any of this stuff. So, and this is, K is for potassium. If you remember your periodic table of the elements, this is magnesium, this is protein. So positive, positive, negative. And then in the space around the cell, which is called the extracellular space, are sodium with a positive charge and chloride with a negative charge. So if you eat a lot of salt, whether that's table salt or Himalayan salt or sea salt, it's about, depending on the salt you use, 97, 98, 99% sodium chloride. So if you have a high salt intake, that sodium chloride is in the extracellular space around the cell, and those arrows there are showing you a process called osmosis. Again, another grade 10 science term that you learned back in the day. Osmosis is the movement of solute from areas of low concentration to high concentration. So it's pulling the water from inside the cell into the extracellular space. And what is in the extracellular space? That's where your lymphedema is. Okay? So if you are starting to notice, oh, my leg or my arm, it's more swollen, and then you kind of go through that Rolodex in your brain. What did I do? What happened? Is it hot, humid? Is it just the weather? Was I sitting too much? And as you go through that, you can think about, well, what did I eat? And did I eat something that's too salty? And if you think, yeah, I think it was that, then this, I just want to confirm for you that, yeah, that's what happens. If you eat something too salty, it's going to swell up your lymphedema. Another physiological process I want you to understand is the mechanism that triggers thirst in your body. Okay, so for thirst to happen, first of all, water is lost from the body, which is natural, right? You go to the bathroom, you lose water, you sweat, you talk, you breathe, the moisture comes out. We just lose that water, okay? Your ionic concentration increases, okay? So those compounds with electrical charges, they become more concentrated. And this moves the fluid from the intracellular space, from inside the cell to outside the cell. It shrinks the cell. And it's the shrinking of the cell that sends a message to the brain, which then sends a message to the mouth that's like, I'm thirsty. And that's what triggers thirst. And the interesting thing about this mechanism that I want to point out is that the shift to the extracellular space happens first before you register that you're thirsty. So my thinking around this for someone with lymphedema, what's the implication of this? And I would say my interpretation is, if you're waiting until you're thirsty, that shift of intracellular fluid to the extracellular space, to the lymphedema space, has already happened. So you may not want to wait until you're thirsty. You want to maybe, and I know this is maybe easier said than done, but maybe try and just stay ahead of it, right? Don't wait until you're thirsty. If you can, just try and be a little bit more on top of your water intake. Now, unlike other edemas, so if you know about medical terms at all, they're kind of interesting because you can understand kind of what's going on just by the prefixes and the suffixes of the word. But edema just is a swelling, right? And lymphedema is a particular type of swelling of lymphatic fluid. But there's cardiac edema, there's renal edema, there's liver ascites, which is another type of edema. And when I was first training as a dietitian, and I, had my job, I remember working for the VON. I think you have the VON out in Alberta, Victorian Order of Nurses. So I worked there as a dietitian. I'd go into people's homes. And, some of the diet orders I would see from the doctor would say, this person's got heart failure, like congestive heart failure. They've got fluid around the heart. Instruct them on a 2-gram sodium restriction and a 1,500 milliliter fluid restriction. So people would have to be very careful to just take little sips of water with their medicine and really just hardly drink it all, because the doctors were afraid of overloading the body with fluid. But we don't do that for lymphedema. It's the exception to the other edemas. And why is that? Well, it has to do with the lymphedema itself. Now, what is unique about it or different about it is the lymph fluid is a protein-rich fluid. So if I've got lymph fluid built up in my arm, and that means there's protein in there, okay, and I become dehydrated, that protein becomes more concentrated and it becomes harder to move it out. And think of everything you do with your lymphedema therapist. You wear a compression garment, you do manual lymphatic drainage, you do exercise, you do proper skin care. All of that is designed to move that fluid out of the limb. It doesn't want it to just sit there, right? It's all designed to move it out, because that compression garment, not just compressing it, it's graduated compression. So that means there's more pressure here, like a 30 to 40 means there's 40 millimeters mercury pressure here, there's 30 here. So it's forcing the fluid up. Same with the arm. It's forcing it up. So if you become dehydrated, that protein becomes more concentrated. The idea is you can't move it out. Now, why is that a problem? That protein, it's like a beacon. It sends out a signal. And the signal it sends out is send macrophages, 911, send the inflammatory cells. Well, here they come. And what do? I'm getting ahead of myself. I'll save it for a couple of slides. Let's finish off here. Tip number 1, limit salt and salty foods. So 1,500 milligrams a day, or maybe 2,000 milligrams a day, maybe 2,300 if you want to just kind of start and then gradually move it down. But get it under 3,000 milligrams a day. Read your labels. Be careful with the salty food, the processed food. Number 2, drink plenty of water. Okay. Now you can't just wake up tomorrow and decide, okay, I'm going to start drinking 2 liters of water a day. No, your kidneys are, you're going to be going to the bathroom all the time. Gradually increase it. Okay. All right. Now let's talk about anti-inflammatory. Both experimental and clinical studies spanning several decades have implicated inflammation as a critical component in the pathophysiology of lymphedema. So when I was talking about that protein sending out the beacon, attracting the macrophages and the other inflammatory cells, what they do is they get there like, okay, let's get to work. Well, what do? They build fibrotic fatty tissue and they thicken the skin. Has anyone heard of the Stemmer sign? So the Stemmer sign is a simple little test. In the case of arm lymphedema, you would use the hand, but in the case of foot lymphedema, you'd use the feet or the toes. But you basically try and tent the skin at the base of the knuckles here, or the bottom of the toes. So I can tent my skin, okay? I can make a little tent. That's called a negative Stemmer sign. If I can't tent my skin, that's called a positive Stemmer sign. And that is fairly predictive of lymphedema. So it's a diagnostic tool. It's more accurate, and if you want to read about it, I do have a blog about the Stemmer sign on my website, but in early stage, it's not as accurate. But once it gets beyond that, it's like 97% accurate or valid, for diagnosing lymphedema. So why does that little pinch test work? Well, that's because if you've had lymphedema for a while, you've got that protein under the skin sending out the message, send the inflammatory cells, here they come. They make that fibrotic tissue under the skin. They thicken the skin. So if there's fibrotic tissue under there and you've got a thick skin, you cannot tent that skin. So that's why, that's you physically assessing. I've got some, definitely I've gotten to that stage where there's fibrotic tissue, okay? And its inflammation is the culprit. And oops, sorry, let me go back. Here's a nice diagram that helps to illustrate this and you notice I'm going to reference my slides here. The article is called The Unresolved Pathophysiology of Lymphedema. So let's say you've got impaired lymphatic drainage, so lymphedema, right? Well, what does that do? That leads to inflammation. As I said, you've got that buildup of proteins sending out the beacon, say, send your inflammatory cells. Well, here they are. Well, what does that inflammation do? Right back at you. Double arrow. creates more impaired lymphatic drainage. Also, inflammation creates fibrosis because the cells are just doing their job, right? And their job is to make this fibrotic fatty scaffold. And that fibrosis leads to more impaired lymphatic drainage, and that impaired lymphatic drainage leads back to more fibrosis. And then that fibrosis, this is sort of a theory here, this is why it's red, leads to adipose tissue deposition and remodeling. That's your fat tissue, okay? More fat tissue, more remodeling of that fat tissue, which leads to more impaired lymphatic drainage, which leads back to more adipose tissue deposition. Oh my gosh, how do we get out of this? All these double arrows, everything's going back and aggravating itself. Well, there have certainly been drug trials looking at, well, can anti-inflammatory drugs help with lymphedema? And there was a successful trial from Stanford, but then they found that drug that they use, oh, well, it's actually, not so safe because, might cause a bit of cardiotoxicity. So that's out. So now there's another drug trial research going on to look at if we give people with lymphedema anti-inflammatories, will that help? And as a dietitian, I'm looking at that going, wait a minute, there's a tool that's already been validated, and it's called the anti-inflammatory diet. So let me tell you about that. So back in 2009, so 16 years ago, this group of researchers wanted to basically develop a scale. They called it an index, okay? The dietary inflammatory index, which dietitians call the DII. Okay, so, or at least I call it that. What did they do? So they basically did a massive systematic review and meta-analysis. So what that means is they didn't actually go into the laboratory. They went and started reading a bunch of research. And what their criteria was is there any research that looks at a food component and your blood levels of inflammation? Because if you're not aware of this, there are actually blood tests that measure the amount of inflammation you have in your body. And these are the tests here. CRP, so that stands for C-reactive protein. Now, if you wanted to get your own blood checked, this is the most common one. So you can either go online and see your own lab results and see if you've got this number in there. You might have it already. If you don't, it's something you could ask your family doctor. You don't have to, race there tomorrow or anything, but next time you go, you could ask them for that if you wanted. Tumor necrosis factor alpha, interleukin 6, interleukin 1 beta, interleukin 4, interleukin 10. These ones probably, I don't know, I guess it's possible you have it on your blood work, but they're not that common. They're more done in the research. But anyway, so these researchers said, if you've looked at blood tests and food intake, we want to include that in our review. And so what they found was there were 45 different dietary factors. So it's nutrients, herbs, or spices that showed either that they raised the level of inflammation or they lowered it. And they were either like weak or strong at doing that. So they basically ranked everything. And what they came up with was 36 components that were anti-inflammatory. So these are the good guys. These are the ones that are going to reduce inflammation, and 9 that were going to drive it up. So let me show you what those were. So anti-inflammatory, these are the good guys. These are the ones you want to eat more of. So foods that are low in sugar, unprocessed whole food, high in fiber, and low glycemic. These first 4 kind of are all overlapping. There's sometimes you could say just different ways of saying the same thing. Because typically if something is unprocessed whole foods, it does tend to be high in fiber. And if it is that, then it's also low glycemic. But there's just different ways to measure it, right? But they're all sort of confirming each other. Also, certain vitamins, A, C, D, E, folic acid, thiamine, riboflavin, pyridoxine, niacin, selenium, zinc, magnesium. And it's not that you have to go start taking all of these supplements, but if you have a good balanced diet, you're going to have those in there. It's got to be low in trans fat and saturated fat. Now, thankfully, Health Canada banned trans fats a while ago. So we don't have trans fats in, let's say, margarine or in our cookies that we buy at the supermarket. You can still get trans fats if you're eating fried food because heating the oil is what creates the trans fat, right? Saturated fats are fats that are solid at room temperature. So always remember, saturated starts with an S and so does solid. So what fats are solid at room temperature? Well, if I take a pound of butter out of the fridge and I set it on the counter, it doesn't melt. It's still a rectangle, right? So that's a saturated fat. If I take a steak out of the fridge, I set that on the counter to marinate. That fat around the outside of the steak, that doesn't melt either. If I take a jar of coconut oil, room temperature, solid. Okay, so these are all examples of saturated fats. These are inflammatory. Okay, now it doesn't mean that you can never eat any of them again. Having an anti-inflammatory diet is a bit like a scorecard, right? You just want to have more foods that are anti-inflammatory than pro-inflammatory. Doesn't mean I could never have red meat again, okay? Foods that are high in omega-3, 6, and 9. Okay, so here's where all the supermarket screamers are not evidence-based, right? So seed oil this and seed oil that, and seed oils are trash. Well, guess what seed oils contain? Omega-6 fatty acid, omega-9 fatty acid, some omega-3 fatty acid. So now I do tend to emphasize the 3 and the 9 over the 6. And that would be, so so these are fatty acids. So a bottle of oil that's liquid at room temperature, like olive oil, canola oil, those would be unsaturated, right? They're liquid at room temperature. But they're made up of different fatty acids. And fatty acids are chains of carbons. So you've got a carbon, 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 carbon. They're connected with bonds, and then they have hydrogen bonds attached, and they have different endings on them. And sometimes they have a double bond between the carbon. So if you have this chain of carbons and you have an alpha end and an omega end, and you count 1, 2, 3 carbons from the omega end, and you see a double bond, that's an omega-3 fatty acid. If it's 9 carbons from the omega end, it's an omega-9 fatty acid. So all this chemistry, why do we care? Well, it's because they behave differently in our bodies. Omega-3s are very anti-inflammatory. Omega-3, what do we think of? Salmon, sardines, herring, mackerel, rainbow trout, anchovies, right? The omega-3 rich fishes, very anti-inflammatory. Omega-9, what do we think of there? Olive oil, avocado oil, high oleic sunflower, high oleic safflower, okay? Now, omega-6, this is one that kind of gets a little more controversial because one study will show omega-6 is inflammatory, one will show it's not, one will show, well, it really depends on the ratio. And that's where I think these supermarket screamers are going on about it. But a lot of new research are saying it's anti-inflammatory. But, I think my opinion is, well, because it's not as consistently anti-inflammatory in the research as the 3 and the 9, then I tend to, in my pantry at least, emphasize oils that are higher in 3 and 9. Oils that are higher in 6 would be canola, grapeseed, regular sunflower, regular safflower, soybean, okay? Okay, and lastly, if it's high in anti-inflammatory phytonutrients, particularly turmeric, thyme, oregano, hot peppers, rosemary, tea, garlic, ginger, saffron, isoflavones. What are isoflavones? It's that phytoestrogen that people always talk about in soy. Yeah, so tofu, edamame, that's isoflavones. On the pro-inflammatory side, it's kind of the opposite, right? There's added sugars, it's processed, it's low in fiber, it's high glycemic, it's high in B12, iron, and protein. Well, that's kind of your saturated fats, right? It's got trans saturated fats, cholesterol, high in total fat. It's got very little herbs and spices. So remember I said, having an anti-inflammatory diet is like a scorecard. So what if, oh my gosh, I just want to have a steak, I live in Alberta and I want to eat a steak because that's my provincial food. Well, How do we make that more anti-inflammatory? We're going to marinate it. What are we going to marinate it with? Some very anti-inflammatory things, maybe some olive oil, maybe some lemon juice, some rosemary, some thyme. I'm going to put that on there. It's going to taste delicious. But what I'm doing is I'm making it more anti-inflammatory. So there you go. Hopefully that helps clarify a few things. There's a lot of myths around the anti-inflammatory diet. You'll have people screaming at you on social media telling you, you can't have dairy, you can't have gluten. Okay, show me the evidence. That's what I say. Anyway, can I just go back here? This research was repeated in 2015. It's been validated many, many times. And over those years, lots of research to show either, if you just get a group of people together and they tell us honestly what they're eating, we look at their blood, we're like, yeah, makes sense. We can see because their diet is anti-inflammatory and their blood levels of CRP are low. Or you take a bunch of people whose blood levels are high and you change their diet to make it more consistent with the DII. Guess what? You can drop that. Now, what we don't have is evidence in a group of people with lymphedema to show, well, if we put them on an anti-inflammatory diet, we can lower their blood levels of inflammation. I'm pretty sure that research that we have from other populations is transferable over to the lymphedema community. I mean, it's been shown in people with metabolic syndrome, people with diabetes, people who have obesity, many, many times. What we don't know yet, but my hypothesis is that would delay the progression of lymphedema. Now, the only way to test that is to look sort of a long-term approach, either to follow people for a long time who have lymphedema and see how much fibrosis they develop, or just get people together who've had lymphedema for 10 years. And some will have nice soft lymphedema where, they can move it, and others will be hard and fibrotic and thick skin and maybe warts and all these growths on the skin. Let's look at their diets. So we don't have that kind of research, but certainly an anti-inflammatory diet you should be doing anyway, because it prevents Alzheimer's, it prevents heart disease, it's a cancer risk reduction diet. So there's no downside to doing this, okay? But I just want to be transparent about the evidence that we have. So tip number 3, anti-inflammatory diet. Okay, let's talk about gut lymphatics. Okay, so this is your digestive system. So you eat your food, it goes down the esophagus, goes into the stomach, then from the stomach, you can't really see it, but it goes into the small intestine, which is this bit here, and then the small intestine goes over here to the large intestine, also called the colon, goes all the way up and across and down, and then it leaves the body. Okay, so that's your digestive system. Here is your lymphatic system kind of superimposed on top of that. So the lymphatic system here you see in this yellow color, and then you see the digestive system in behind. But notice there's a lot of action down here in the intestines. And you have hundreds of lymph nodes throughout your body, like some estimates, like 700. And they're in clusters, right? So clusters under the arms. Well, there's a big cluster. In fact, the biggest cluster is in the mesentery. And the mesentery is the lining that keeps your intestines attached to the abdominal wall. And it's rich, 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 full of lymph nodes and lymphatic vessels. In fact, more than 50% of the lymphatic fluid that your body produces comes from the intestines. And the amount of lymph fluid increases every time you eat. Okay, so it's very important. So if we're to put a scope down, like an endoscopy, down your esophagus, down the stomach, into the small intestine, this is what it looks like. And these guys here, these little finger things, these are called villi, okay? And the reason the intestines is full of villi is to increase the absorptive capacity of the intestines. Okay, because as your food is going through, the body's job is, okay, I got to pull out the vitamin A and the vitamin C and the vitamin D and the thiamine and all the vitamins, all the nutrients that you need. It has to grab it because the body needs it. Well, you're going to be more efficient at grabbing all those nutrients if you've got more surface area to do that. Okay? So that's what it looks like. Now let's just zoom in on one of these villi. Okay? And let's look at this image right here. So as you eat the food, let's talk about fats in particular. So let's say I put some mayonnaise on the bread, I'm making a sandwich, and I have a salad, and I've got some salad dressing, and maybe I've got some avocado on my salad. I've got, at least 3 different sources of fats. So once they get into the intestine, this is where the body breaks it down. It has to break the food apart, get it down to its smallest component before it can be absorbed, through those villi, right? Well, fats are broken down into fatty acids. And I told you before, fatty acids are chains of carbons. Some have double bonds, some don't. Okay? Now, the other thing I want to talk to you about these carbon chains is some are short. So some have only 6 carbons in the chain. Some are medium, which means they have 12 carbons in the chain. And some are long, which means more than 12 carbons. So once those fats go past the stomach into the intestines, they're broken down into fatty acids. The short and the medium get absorbed directly from the small intestine into the portal vein. Boom, they're now absorbed by the body. So that's what's referred to as digestion and absorption. Okay? Big terms in the dietitian world. Now, long-chain fatty acids cannot be absorbed here. They are not soluble enough. So they get put into something called a chylomicron. It's a fat transporter sphere. And then that chylomicron approaches the villi, and around the villi are cells, but it's not solid. There's a pathway in between. So it goes in there, gets absorbed into the villi. And each villi has a single lymphatic capillary. So all those millions of villi that I showed you, each one has a lymphatic capillary, one single lymphatic capillary in there, okay? It has a special name. It's called a lacteal, okay? Everywhere else in the body is just called a lymphatic capillary. In the intestines, it's called a lacteal. And so that lacteal is going to absorb lymphatic fluid, but those long chain fats that couldn't be absorbed into the portal vein. So every time you eat, what your lymphatics in your gut create is this mixture of lymphatic fluid and fat from the diet, or these long chain fatty acids. And this liquid is called chyle. And it is a milky white color. And when it was first discovered in the 1600s by an Italian physician, he thought this looks like milk, right? It's milky looking. So he gave these lymphatic capillaries the name lacteal, because if you know Italian or Latin or French, lac, L-A-C, is the word for milk, or lait, of course, in French. So that's why these lacteals got named that, because they have this milky liquid in it. Okay. So then they get absorbed, and as you can kind of see here, the lacteals connect. They all connect to each other. So then they're going to work their way through all those lymph nodes in the intestine, go up to the cisterna chyli, this little hub here, and then up the central lymphatics, and they get absorbed up here, the terminus, like all the other lymph fluid in your body, right? And then those spots now get absorbed into the bloodstream up here behind your collarbones. So how can this help us? How can this information help us when we're deciding what's the best thing to eat when we have lymphedema? Well, let's first look at which oils are short, medium, and long chain. So I've divided this chart into short, so less than 6, medium, 6 to 12, long. And here's a bunch of oils over here. And if I draw this line across here, this makes it a lot easier. So everything below the line, canola, corn, flax, olive, palm, safflower, sesame, soybean, sunflower, 100% long chain. And you're probably thinking, I thought olive oil was healthy. Let's not confuse healthy oil, like oil that's anti-inflammatory or oil that's going to lower your cholesterol with where it gets absorbed in the body, okay? Because that's not an indicator, okay? All this is telling you is that these oils require the lymphatic system for absorption. If we look above the line, we've got butter, which is 5%, 7%, and 89. Palm kernel oil, so that's different from palm oil. If you've ever seen a palm nut, it's got a fleshy bit on the outside and then a nut on the inside. So the palm oil is from the fleshy bit, the palm kernel oil is from the nut on the inside. Anyway, 55, 45, coconut oil 64, 36, and MCT oil 100%. Well, I've never heard of an MCT tree or an MCT nut. Well, it's because there isn't one. And so how or what the heck is this? So it stands for medium chain triglyceride. Triglyceride means 3 fatty acids with a glycerol backbone, okay? And what they do, how they make this is they take either coconut oil or a combination of coconut and palm kernel, and they separate the different fatty acids. The long go one way, the medium go another way, and then they get put into a bottle, slap a label on it, MCT oil. I'm not endorsing any of these oils. I just grabbed some to show you. What you can see, it's very clear oil. It has a very mild taste, maybe like a little bit of coconut flavor, but that's what that is, MCT oil. So let me show you about a couple of studies. And these are just, this one is case studies. So case studies are not considered strong evidence, okay? But this is what we've got. So it's 2 women who had primary lymphedema in one leg only. One leg was healthy. So they were advised to go on a low-fat diet. So they were told that of all the calories in their diet, only 20% of their calories can come from fat. How to figure that out? If you have one of those apps like food tracker apps, it will usually break down your calories as a percentage. If you are curious, if you just want to add up the total calories of what you're eating and the total number of grams, fat has 9 calories per gram. So then you multiply the total number of grams by 9 to get the total number of calories from fat. You take that over your total calories in the diet. That's where you get your percentage. Who knew there was so much math in dietetics, right? Okay, but anyway, that's what they did. So in other words, it's a low-fat diet. Just take my word for it. I think most people have about 30% of calories in their diet from fat, some even higher. So they had low-fat diet, plus they were allowed to use the MCT oil, okay? Because again, it doesn't require the lymphatic system for absorption. They did this for 4 months. So patient A, after 4 months, had lost 22 pounds. Now, patient A was overweight. She reduced the perimeter of both her thighs, which you would expect when you lose weight. She lost 7 centimeters in her lymphedema thigh, 5 centimeters in her healthy thigh. So the net reduction of lymphedema was 2 centimeters. Patient B was not overweight. She was already within her ideal weight range. So when they reduced her fat, they must have given her more lean proteins and carbohydrates in order to keep her calories the same so she didn't lose weight. So she didn't lose weight, but she lost 3 centimeters from her lymphedema thigh. So something might be going on there, okay? Let's look at the next study, which was breast cancer patients, only 10 of them. They all had arm lymphedema. And with this one, they basically said, here's a bottle of oil. We're not telling you what's in it, but this is the only oil you're allowed to use for the next 4 weeks. So 5 of them got MCT oil, 5 of them got corn oil. And then afterwards, they came back. The corn oil group had gained 75 milliliters in their arm. The MCT group lost 200. And they also reported a significant decrease in the feeling of arm heaviness. So my next tip number 4, limit your fat intake with a possible inclusion of MCT oil. Now, here's what's not going to work. Keep your diet exactly the same and add MCT oil. That's not going to help you. It's not like taking fish oil, right? It's not like, oh, this is an anti-inflammatory that's going to help me. No, the MCT oil just allowed these people, let's say you're on a low-fat diet and you think, I don't want to eat my salad without any oil. It doesn't have any flavor. Okay, well, you can make a little dressing with MCT oil and lemon juice and oregano and garlic and put that on your salad, right? Or you want a little drizzle for something, you can use the MCT oil. But just adding MCT oil without reducing the fat content is not going to help you, okay? But again, another thing to put through that Rolodex in your brain, if you're like, oh, my lymphedema is bothering me today. It's up. What's going on? You can think, oh, did I have more salt? Did I not have enough water? Did I eat something that was too fatty? All right. Now let's continue with the gut. And let's talk about the three main structures of the gut lymphatics. So we know about the villi. I introduced you to the villi, and I've introduced you to the lacteals. The other thing you need to know about is the microbiota, okay? Because the one thing about the villi have a little bit of propulsion. They have a little bit of motion that they can do. Whereas the lacteals are like la-di-da, la-di-da. They're like the anemone. They're just like floating around. And the other thing about the lacteals you should know is that they slough off. So just like, I'm going to brush my hair and some of that hair is going to come out in the brush, or if I had dry skin, just like it's flaking off, right? The lacteals are like that too. And what helps you to have a good population of lacteals is something called VEGF-C, which stands for vascular endothelial growth factor C. Where does VEGF-C come from? It gets secreted by the villi. How does a villi know to secrete it? The microbiota tells it to. So these three things are all very important. Keep that in mind when I share with you this next study. So this study was done in Iran with 88 women who'd had breast cancer and all had lymphedema. So all of them were given the same diet protocol, very anti-inflammatory Mediterranean diet with some less calories what they were typically consuming to allow them to lose weight. But here's where the difference came in. Half the group got a placebo pill. The other half got a synbiotic supplement, which is a combination prebiotic, probiotic. I'm going to tell you a bit more about that in a second. What happened? Well, the ones who got the probiotic reduced more lymphedema significantly compared to baseline and more than the placebo plus low-calorie diet, and lowered their blood levels of inflammation more than the placebo group. Okay? So this gut is important. What's a symbiotic, prebiotic, probiotic? What's all that? So probiotic, most of us are familiar with. It's the live bacteria. So if you eat yogurt, it's got living bacteria in it. That's probiotic. When I was at the conference where I met Allison from the ALA, there was a talk on fermented foods, and there's a demonstration on making your own sauerkraut, right? So there are other fermented foods which would have live probiotic bacteria. Now, prebiotic is a type of fiber, and it's fiber. Not all fibers are prebiotic, but certain ones are prebiotic, means that they can feed or fuel your microbiota, your own little population. Well, not little, it's like millions and billions of bacteria that live in your gut. Keeps them happy. So in this case, this picture here is chicory root, and if you grind up chicory root into powder, that powder is called inulin, and you might see that on some of those products like bread with added prebiotic fiber or pasta with added prebiotic fiber. It's in the supermarkets now. You can even just go to the section of the pharmacy where they have the Metamucil and those fiber powders. You can just buy inulin. It's there. But so the supplement contained about 6 different probiotic strains. So probiotic strains, that's things like Lactobacillus acidophilus, where they actually name the bacteria, right? And some fiber. So that's what was in their supplement. So tip number 5, eat probiotic bacteria and prebiotic fiber. Pay attention to your gut health and your bowel routine. When I teach my lymphedema nutrition school, I've had many people I see these aha moments of like, oh my gosh, I had no clue that my IBS, when it acts up, my lymphedema is worse. Or, oh my gosh, when I'm constipated, my lymphedema is worse. All of these things where your gut, or it's like if I'm bloated, my lymphedema is worse. So your gut is actually really important for your lymphedema. All right. And now in that case, if that's say they actually took a supplement, and I mean, I can't sort of globally recommend supplement for a bunch of people that I don't know, but generally speaking, they're safe. If you're immunocompromised, not a good idea. It's not good for infants, but most people can safely handle that. 7 reasons why intermittent fasting may be good for lymphedema. Now, when I say intermittent fasting, I'm talking about time-restricted eating, not, daily fasting. And not to say that that's bad, but just that it's not what I had in mind when I was writing this, okay? So time-restricted eating, basically, it's like we all do time-restricted eating, whether we pay attention to it or not. But basically, you have 24 hours in the day. A certain part of that day is your eating window. So once you start eating, so once you have your breakfast or you break your fast, that's your eating window has begun. And once you finish eating for the day, now your eating window has closed. And you think about, what time do I start eating? What time do I finish eating? What is that window? That's your eating window. And then your fasting window is once I finish eating until breakfast the next morning. It's my fasting window. So what you do with time-restricted eating is you're just more intentional about it, okay? And what I recommend for my students is to start with 12-12. So that means if I start eating at 7 a.m., I have to finish eating by 7 p.m. That's 12 hours. And then I'm fasting from 7 p.m. until 7 a.m. the next morning. That's the place to start. So if you're starting eating at 7 a.m. and maybe you have a little bit of snack and you're done eating at 9:30, your eating window is longer than your fasting window. So that's not good. You want to get it to that. Now, why? Anti-inflammatory. There is weight loss. Now, it's not more than traditional calorie restriction. It's the same. Muscle maintenance. As long as you're working out, you're not going to lose more muscle just because you're doing time-restricted eating. Bowel rest. This is the thing that got me really excited in terms of lymphedema. Because remember I said more than 50% of your lymph fluid comes from your intestine. It increases every time you eat. What if you gave your bowel 12 hours to process all that and get that lymph fluid and clear it out before you ate again? I really think that is key. Improve microbiota. We now know that that's important, right? Microbiota is going to trigger the villi to release the VEGF-C, and then you're going to have a good population of lacteals. You're going to have good absorption. You're not going to be like having leaky gut and all these problems. Reduce blood pressure. Blood pressure is key for lymphedema. Reduce cholesterol. There's new research showing that your blood lipids, I think, are going to matter here with lymphedema. Okay, and if you want all the references and more details, then I wrote all of this up in a blog. Tip number 6, if possible, fast at least 12 hours overnight. I gotta speed up a bit. Protein. There's a condition called sarcopenia, which is basically fancy medical term for muscle wasting as you get older. And it's just a fact of life. We don't want it, right? Especially if you have lymphedema, you're moving your muscle. That's why exercise is one of the components of complete decongestive therapy, is going to pump those lymphangions and move that lymph. And if you have less muscle, that's not good. Get enough protein, do your weight training. Now, it doesn't have to be big weights like this, but some kind of resistance training. How much protein do you need? Now, again, protein needs vary, but a good ballpark is 1 gram of protein per kilogram body weight. But obviously, if you're going through chemotherapy, it's more. If you're doing weight training, it's more. If your body's under some type of stress, it's more. Number 7, meet your protein needs. Okay, so in summary, limit your salt and salty food, drink plenty of water, eat an anti-inflammatory diet, limit your fat intake, and possibly try some MCT. Eat probiotic bacteria, prebiotic fiber, pay attention to your gut health, your bowel routine. If possible, fast at least 12 hours, meet your protein needs. Bonus tip, tracking. So if you want to track your lymphedema and also track your intake, then you can do that, something like this. And then you look back on the week and say, oh, what was going on here on Wednesday? What the hell? Well, let's have a look. What was I doing that's different? What did I eat that's different? Or what did I eat Tuesday night? Right? And in addition to all these things that I talked about, I think there might be some individual triggers, because if there's something you're not tolerating, maybe your lymphedema is responding. And then this book, I'll show you side by side. So this is a lot smaller, but actually more detailed because you're writing out each food like line by line. So these are available on Amazon if you want to get one. I have them for lipedema and lymphedema. Bonus number 2, you don't have to do it alone. I do have a program called Lymphedema Nutrition School. It's starting October the 14th. It's 10 weeks. So if you like my style, if you learned a lot tonight, oh my gosh, imagine what you're going to learn in 10 weeks. 90 minutes each week. Lots of time for asking questions, setting goals, meeting the other people. That's the beautiful thing about this group, because it's not going to be like this, not just me yakking at you. Everyone's got their camera on, their microphone on. We're all, sharing, talking. Plus you get a daily journal, my book, The Complete Lymphedema Management and Nutrition Guide, 2nd edition. This is the brand new one. It just came out this year. And my newest book, Complementary Therapies for Lymphedema, which is not even out yet, but you'll get it. It'll be out by October the 14th. All right. So that's all included. I know we don't have a lot of time, but if there are questions, happy to take that. If you want to join Lymphedema Nutrition School, just shoot me an email, go on my website. Let's get you signed up. I'm only taking 10 people. So, all right. Let me check the chat and see what's going on over here.
Yeah, if anyone has any questions, feel free to put them in the chat or just unmute yourself. Jean, this was so interesting. I wish that my science teachers explained things the way that you did today.
Right, you might have done better in chemistry class, right?
Yeah. I have a question, I guess. You started off by saying, it's really important to find the right diet for the patient as well as the plan that the person will follow. So I know when you're dealing with any kind of illness or chronic health condition, it can be overwhelming, all the things that you suddenly have to do. Do you have any staple ingredients or staple recipes that you would recommend, or those in your book that people could maybe go to as an easy start?
Okay, I think an easy start. I mean, you can pick any one of those things that I talked about tonight. Start with whatever feels the easiest, because it can be overwhelming. You think, oh my gosh, now I got to do all this, right? Start with whatever feels like the easiest. If you're not really much of a salt person, start looking at your labels and pay attention. And maybe there's a few simple substitutes you can make. Start with that. You might, and one tip I give to a lot of people, which if this seems easy to you, then try this one, is I challenge them to use herbs and spices at every meal. So maybe it's cinnamon at breakfast. Maybe it's oregano, basil, rosemary, garlic, ginger, thyme, sage, savory, chili, turmeric, you name it. They're pretty much all anti-inflammatory. So open up that spice cupboard, start putting stuff on your herbs and spices in your food.
Right, just adding it to whatever you would be eating anyways.
Exactly. Yeah.
Okay.
Or
Diana,
doubling it up. If there's already, if your recipe calls for half a teaspoon, add a full teaspoon,
yeah,
right?
why not? They taste good anyway. Diana asked, what foods should someone that had estrogen positive breast cancer not eat? And maybe a long
Um,
one, but if you can give
Really
it.
similar to what we talked about with the anti-inflammatory diet. But if you're looking for things there like foods with estrogen, no, that's not a thing. That's, again, those supermarket screamers will tell that to you. But there's no need to limit soy. There's no need to limit, legumes or dairy products or oils. All of that is fine. So what I would limit would be, added sugars. And notice I say added sugars, so that doesn't mean limit fruit, okay? Limit added sugars, limit processed foods, uh, limit saturated fats, trans fats, just a healthy, well-balanced diet, lots of plant matter, so lots of, vegetables, fruit, herbs and spices. If you're having grains, then have whole grains. Yeah. Could I comment on alcohol use? Yeah, so I've not come across any research looking at alcohol and lymphedema. I do, though, tend to hear from my clients that they do find it's kind of one of those trigger foods. So that's something you can pay attention to for yourself and notice if you think it could affect it in a couple of ways. One, it could just have a direct effect that the alcohol causes your lymphedema to swell more. Or could be more of an indirect effect because when you have alcohol, maybe you're eating more. That's what the research says. You have less portion control, you fewer inhibitions, right, with eating. And maybe when you have alcohol and you overeat, then that affects your lymphedema. So I would just pay attention to it. Certainly, if your lymphedema is due to cancer, then alcohol, you really do need to be careful because they're finding more and more links now between alcohol consumption and cancer risk. So that's all I can say about that. There's nothing in the evidence around alcohol. Oh, you're welcome for the presentation. So don't forget that in addition to, wearing your compression garment, doing your manual lymphatic drainage, seeing your lymphedema therapist, taking care of your skin, being active, there's a whole other world out there that, what you eat can really have an impact on your lymphedema. And I'll share with you one of the students that joined lymphedema nutrition school a few years ago now. She was a retired nurse. She was extremely what in the medical community they would call compliant. She wore her compression garments every day. She saw her lymphedema therapist every 2 weeks. She was sort of textbook doing everything that was recommended. She joined lymphedema nutrition school. And in lymphedema nutrition school, we do one topic a week, and then you set a goal for yourself. And then you focus on that goal. And then you kind of observe, oh, what did this do to my lymphedema? And during the 10 weeks, she was due to go back for her visit with her fitter. I think that's actually near the end. And she went back to the fitter, and the fitter said, what are you doing? These are the best measurements you've ever had in the years that you've been coming to see me. And she said, yeah, I'm changing my diet. I'm doing different things with my diet. And she'd had lymphedema for 30 years. So if you think it's too late for me, like I've had it too long, she's always the example I think of when, even someone who's doing everything, sort of quote unquote textbook, right? there's a lot that nutrition can offer. And it doesn't have to be deprivation, right? If you like, you can focus more on what you can add to the diet versus what you have to take away. Are the classes during the evening? So the classes are 1 to 2:30 Eastern, so that's 11 Mountain. If there's
11
enough
a.m.
demand, I would do an evening class if we have enough demand. So if you know some people, I'm happy to host an evening class. But in the past, when I did one, I didn't get as many people joining, so I've kept it during the day. But if you and half a dozen of your friends want to do an evening class, I'm happy to do that.
Cool. Well, that's something we can definitely maybe work on together in the future.
Yeah, like if there's a group, through that connect through the ALA and they want to have a class, and I'm happy to do that.
Yeah, it's a great idea. And is the class marketed more towards patients or therapists or both?
So this is for patients. I have a separate one for therapists. It's called Lymphedema Nutrition for Health Professionals. And
Okay.
that's pre-recorded. So it's available right now. People can sign up, take it, and start going through the modules. Yeah.
Okay. Amazing. If there's no more questions, thank you, Jean. This was absolutely amazing. We look forward to getting the recording up for anyone who missed it, or if you want to rewatch your favorite parts or share with friends. I know we did have therapists and patients on the call, so we have a good breadth of people who would have benefited from this. So thank you so much.
You're welcome. All right. Bye, everybody. Come visit my website.
Have a good evening, everyone.
Yeah. Thank you
Bye.
so very much, Jean.
Oh, you're welcome.